This medicine video will focus on the long-axis right ventricular inflow view. This is taken directly from Echocardia, the echocardiography resource. A link to the website will be provided in the description below. The long-axis right ventricular inflow view, the probe position. The right ventricular inflow view using the long axis can be obtained by tilting the transducer when performing a transthoracic standard parasternal long axis view. It depends from where you start and on the configuration of the thorax and the scanning position if you have to tilt it towards the left shoulder over towards the right hip of the patient. Even a little bit of rotation is sometimes necessary. The long-axis right ventricular inflow view is used to examine the right ventricle and the right atrium. This view is also useful to search for tricuspid regurgitation or tricuspid valve prolapse. On the left side of the screen is the inferior right ventricular wall, and on the right side of the screen, the anterior wall of the right ventricle is visible. It's often discussed which tricuspid valve leaflets can be seen in the right ventricular inflow views. Traditionally, the left side of the screen, the posterior leaflet was assigned, and the anterior leaflet on the right side. However, this is not always the case. The septal leaflet can also be found on the left side of the screen, with the posterior leaflet displayed on the right side. There's also a possibility that on the left side the septal leaflet is placed and the right side the anterior leaflet is visible.